First, can you all see my screen, please?
Yes.
Yes.
Great.
Yes, we can.
All right. Once again, my name is Temitope Sogbanmu. Like I've been rightly introduced. And just before we kick off this seminar, I would like to invite participants to kindly take a short poll that has to do with our awareness about the UN SDGs and the AU Agenda 2063 goals, as well as to have an idea of the categories of participants here. If you could just take that quickly in the next 1 minute, please. And Kiki would share the results. Thank you. So while we take the poll, I can just start with some brief introductions. And today I'm talking about the United Nations Sustainable Development Goals and the African Union Agenda 2060 goals. And our focus really, my focus this evening is to talk about the environmental health priorities for Nigeria. I'm an environmental toxicologist. I lecture at the University of Lagos, and I'm a member of different societies, and I'm going to be talking about that soon. Do we have any results yet, please?
Yes, we have 13 people who have completed the poll already. So we just, out of the 24 people who are currently in the meeting.
Okay. If you could just share so that at least I have an idea of the number of participants.
You went that way.
Okay. So while we get that going, the outline of today's presentation. Kiki, do I still have the floor?
Yes, you do. You do, please.
My slide is not moving. That's why I'm wondering what's happening.
Oh, okay. You still have the floor. You still do.
Okay. Let me try that once again.
Okay. So we have 16 out of 27 people who have voted.
Okay.
Could you all please complete the poll so that we have the results in real time and then we're able to share it with everybody? Thank you.
Okay, the slide is moving now. So I'll be guided by this outline. First, I'll talk about my background because this is a mentoring webinar and a lot of the focus really has to do with the mentees that we have in the OHAM initiative and who are really interested in working with mentors, of which I'm one, to learn from their experiences and to be able to use that to better themselves, particularly in the field of environmental health and One Health in general. So I'll talk briefly about my background. Then I will talk about environmental health versus environmental pollution, current environmental health challenges in Nigeria, the UN SDG goals and environmental health priorities for Nigeria, the AU Agenda 2063 goals, as well as the environmental health priorities for Nigeria. I'll talk about the management and future perspectives. I just want to give a disclaimer that the views that I present in this presentation are actually personal and they're not necessarily representative of my institutions or international or national government agency views on environmental health priorities. So they're basically a distillation of my thoughts over the years in this field and having been acquainted with the UN SDGs and the AU Agenda 2063 goals, what I find to be environmental health priorities for Nigeria. So by way of background, I have a BSc in zoology and my postgraduate degrees were in the area of environmental toxicology and pollution management. And I've had varied international research experience from part of my PhD, which I did at the King's College London, and then short-term postdoc research at the University of British Columbia, specifically the Institute for the Oceans and Fisheries, and currently at the Helvetia Hafen University in Germany. In terms of my work experience, projects, I lecture. I've been a lecturer at the University of Lagos for the last 6 years. I currently lead the evidence use in environmental policy making in Nigeria, and I'll talk more about that when we're rounding up this talk. And you'll probably see the reason why I have a lot of interest in environmental health priorities for Nigeria as regards the SDGs and the Agenda 2063 goals. Okay, thank you. So I see we have a lot of researchers here. A lot of people are aware, but unfortunately, no one is aware about the okay, we don't have so much awareness about the AU agenda. Okay, that's fine. Thank you very much. I'm also opportune to be on panel reviews for the Federal Ministry of Environment on environmental impact assessments in Nigeria since 2018. And I particularly review as an ecology or waste management expert. I've been opportune to hold the science advice for policy fellowship at the Federal Ministry of Science and Tech. And I've had varied industry experience, particularly before I got into academia, with internships at the Elf Petroleum Nigeria Limited. I actually served for 1 year at the Department of Petroleum Resources in Sokoto, and then I worked with an environmental consulting company. And currently, I also am opportune to review grants and academic applications. So basically, my experience and the things I'm sharing are actually captured from this varied work experience that I've gathered over the past 10 to 14 years, really. Okay, so screen is not sharing again. Please bear with me. Okay, and these are the logos for the organizations that I talked about. I am currently an affiliate of the African Academy of Sciences, a member of the Nigerian Young Academy, a member of the Board of Trustees of the Society for Environmental Toxicology and Pollution Mitigation in Nigeria, a member of the Society for Environmental Toxicology and Chemistry, as well as a member of the Society of Toxicology. And my research interests varies from wastewater treatment methods development to evaluating effects-directed analysis of sediments and wastewaters, method development for fish embryo toxicity studies, particularly using indigenous species, ecological risk assessment of polycyclic aromatic hydrocarbons, pesticides, and wastewaters. I recently got into looking at the interactions between climate change and pollutants and how these affect aquatic biota. And finally, I am also involved in environmental risk communication to stakeholders and policymakers. So when we talk about environmental health, what are we really saying? A lot of the times it seems like when you talk about environmental health and we talk about pollution, we're talking about the same thing. But really, I did a bit of search, and really environmental health is sometimes, most times referred to as a branch of public health, and it usually focuses on the human health. So it's looking at what are those factors in the
If you're not talking out to speak out now.
Okay, are we all hearing?
Please, can you mute your microphones?
Okay.
Please, can you mute yourselves? Please mute yourselves.
Okay.
Dr. Kiki, please, can you mute everybody from there?
I have.
Okay, thank you.
So when we really talk about environmental health, we are talking about how environmental factors and environmental pollutants, how they interact specifically with human health. Well, when we talk about environmental pollution, again, man comes into play, but we're looking at the effects or adverse effects that occur from this release of substances, which could be biological material, chemical, or energy, but how it affects not just humans, but other occupants of the ecosystems, like animals, plants, and all of that. So just to say that when in this respect, the environmental health that we're focusing on in this presentation has to do with those factors that interact and basically brings about adverse health outcomes in human beings. And so how does the environment impact health? We know about air pollution. It can impact your health when you inhale pollutants. You can have inhalatory diseases. You can have effects from inadequate water or poor sanitation, exposures to chemicals, exposures to radiation. Even noise can be a pollutant when it gets to the level when it causes effects to hearing or causes poor hearing or hearing loss completely, particularly those in occupational settings. So we talk about occupational risk of pollutants in such instances. We also have occupational health effects arising from agricultural practices. For instance, people spraying pesticide at the non-recommended levels, and they inadvertently inhale this either dermally or even through their nose, and these can cause adverse health outcomes. Effects from even within built environments, from indoor air pollution, and of course, climate change. So moving on, I said to talk about, so what are the current environmental health challenges that we have in Nigeria? And when we're preparing this presentation, for those of us who particularly live in Lagos, this picture that I have here will perhaps remind you of Oshodi. And perhaps what you would think is that this is actually Oshodi, but thanks to proactive measures by the Lagos state government, Oshodi is actually now much more better than this. And so this picture you're seeing here is actually a picture from Onitsha. And this is the state. You can see even signs of smoke right there in the air, and you can see a lot of solid waste and all of that. Here is actually Lagos. In this picture here, we have Bariga. And you can see that people literally have houses built on waste. Of course, these wastes are obviously generated by them and just dumped there, and they literally walk on it, they eat there, they live there, and you can imagine, you know. And we also have this in the Makoko area. Again, for those of us who are familiar with Lagos, the Makoko area supports a population of, at last estimate, about 1 million, up to 1 million people. And these people live in shanties like this on the water, and they actually literally step on solid waste like this. This picture here is Kaduna. And of course, again, for those of us who are aware about the situation in Niger Delta, we have this kind of gas flaring and releases that is peculiar in that region. But this picture is actually Kaduna. And so environmental pollution constitutes one of the most prominent SDG challenges. But you would see that it doesn't cut across just the rural areas. In fact, the pictures that you see we've shown here are actually pictures of urban areas, which is actually where we have a lot of the population in Nigeria. So we look at solid waste, we have issues of industrial waste. Are they properly treated? Are they treated at all? I particularly work in the area of wastewater testing for the past 4 years, and it would amaze you that a lot of these wastewaters get discharged into our environment, whether it is aquatic ecosystems or even sometimes into land. For instance, wastewaters from saloons just get discharged directly into the drainages. And these are composed of chemicals from air products and the like. We have water pollution. It could be from non-point sources, that is indirect sources, or from direct sources, actual direct discharge of effluents or wastewaters into the environment. We also have the impacts of climate change. Currently, Lagos State have been experiencing flooding in the last few days. I've been following the headlines, and I've even heard of cases that is so bad, people literally get swept off by the flood. But what particularly interests me with the news, because again, I'm an environmental toxicologist, is the quantum of waste that gets washed out of the drainages during this period of floods. And of course, this would directly get washed off into surface waters and compound the problem that we have already. And then we, of course, have oil spillage, amongst others. Just a bit of facts. According to the United States USAID, health indicators in Nigeria are some of the worst in Africa. And we can perhaps correlate this with the fact that Nigeria has the highest population in Africa, and of course, one of the highest in the world. Nigeria is also, because of its fast-growing population, is estimated that by 2050, which is in 30 years' time, we would have a population of 440 million people. That is up to 500 million people. And then, according to the UN International Air Quality 2020, it says that annual fine particulate matter PM 2.5 in particular is reported to be, Nigeria is reported to be the 5th most polluted in Africa of particulate matter. And Kano is regarded as one of the most populated cities. Of course, you probably have thought that Lagos would top this chart because this was the chart, this was the information we would have had for Lagos. But like I said, in recent times, Lagos has actually been quite proactive. And we see that other cities in Nigeria, upcoming metropolitan cities in Nigeria, are actually topping the charts in this area of air pollution with respect to particulate matter. In terms of solid waste, about 32 million tons of solid waste are generated annually. And out of these, just 20 to 30% is collected. And unfortunately, I'm sure that those of us who live in Lagos and some other urban or metropolitan areas of Nigeria will agree with me that we have problems with solid waste collection. Let's not even go into the issue of whether these wastes are even sorted or whether they are recycled or whether they just end up in the environment. We are talking about, are they even collected from source? Only 20 to 30% is collected. And we actually have this data. This is from Bakari et al., but from data from our own studies has actually shown that some areas that are even inaccessible in terms of the road network don't even get their waste collected. It doesn't matter whether they're willing to pay. It's just that the waste collectors can't access where they are. For instance, areas around Makupo, they basically discharge their waste into the aquatic ecosystem because one of the things from our data, from the results we've had, is that these waste collectors can't access because of the poor road network. In terms of basic sanitation, about 116 million people. And I wonder how many people are actually in Nigeria now. So if we're looking at a population of 220 million, we're saying that over half of that population does not have basic sanitation. And just to tell you that this population is not just those in the rural areas, because usually when we talk about WASH, we always talk about those who live in the villages. But even in the urban areas, it will surprise you that even basic sanitation can be a tremendous challenge. About 37.8 million people practice open defecation, and about 55 million do not have access to clean water. It's a known fact in Nigeria that most of us actually arrange for our own water, whether it's drinking, whether it's for basic domestic. A lot of us use boreholes dug by ourselves, and we don't have, about 110 million people don't have access to basic hygiene facilities. In terms of the children, about 60,000 under the age of 5 die from diseases just because of poor access to water, to sanitation, and to hygiene. I mean, these are the current issues and facts that we have about environmental health and the adverse impacts in Nigeria at the moment. So what are the UN SDGs? I don't want to belabor this issue because I can see that 90% of the participants are actually aware of what the SDGs are. Just to reiterate that there are about 17 SDGs. However, the environmental health goals, I've identified about 7 of those goals that relate to environmental health. And the first one is the goal number 1 on no poverty. I will go into the details of the targets and specific indicators that has to do with environmental health. The second one is the goal number 3 on good health and well-being, obviously environmental health. Goal number 6 on clean water and sanitation aligns with the facts that I just presented earlier on. Goal number 11 on sustainable cities and community. Goal number 12 on responsible consumption and production. Goal number 13 on climate action. And finally, goal number 14 on sustaining life below water. are the environmental health goals that are identified from the UN SDGs. So let's go to goal number 1. So the specific target 1.5 says that by 2030, and when this came up in 2015, it looked like 2030 was a million years away, but 2030 is just 10 years down the line. It's saying that goal, the target 1.5 is to reduce exposure of vulnerable populations and poor people and their vulnerability to climate-related extreme events, social and environmental shocks and disasters. And the specific indicators is the indicator 1.5.3 that has to do with national and local disaster risk reduction. So in terms of what are the priorities for Nigeria as regards these targets and indicators, what are the specific data that we have at the moment on national and local disaster risk reduction as it relates to reducing exposure vulnerability? For goal number 3, the specific target that has to do with environmental health, we have picked out is target 3.9. And it says in 10 years' time, we need to substantially reduce the number of deaths and illnesses from exposures to adverse chemicals, air pollution, water, soil pollution. And of course, substantially would be relative. I mean, there's no specific number. But what essentially that would mean that those data or figures that I presented 2 slides before needs to reduce to, say, 10 to 20% in order to be able to say we have achieved this. And what are the indicators? 3.9.1 says mortality rate attributed to household and ambient air pollution must be taken, must be looked into, must be compared before and after. And you would agree with me again in Nigeria that one of the biggest issues that we have in terms of household air pollution is from generator exhausts. At the University of Lagos, in our research group, we've actually done studies where we've actually simulated generator fumes to lab rats, and we've actually seen adverse effects to lung function, even to activity, and there are studies that have shown effects even to the mental health. So in terms of reducing the mortality rate, then we really need to look at the issue of, generators and electricity, alternative renewable energy for electricity. Also, 3.9.2 has to do with mortality rate attributed to unsafe water, unsafe sanitation, and lack of hygiene. So it basically means that in Nigeria, we need to improve access to clean water, access to sanitation, both in the urban areas and the rural areas. And we also have to address the issue of lack of hygiene. And I will talk about the actions for this, that this roles or these indicators cannot be achieved alone by government. All hands must be on deck. And it also involves the populace themselves. It involves the people themselves in order for us to be able to achieve these indicators or strategies. 3.9.3 says mortality rate attributed to unintentional poison must be taken into consideration. When we talk about unintentional poison, for instance, I'm not talking about intentional ones like people committing suicide and taking up pesticides and the like of that. I'm talking about people getting accidentally exposed to potentially poisonous chemicals or even work conditions which can actually bring about death. So in terms of good health and sanitation, these are the environmental health priorities that we really need to begin to consider. I don't want to say we're not considering yet, but we need to put more action into it because we have 10 years to achieve these targets. For goal number 6, we have clean water and sanitation. And here is essentially talking about improving water quality. How do we do that? We need to reduce pollution. We need to eliminate, not reduce, eliminate dumping, people dumping waste, people dumping chemicals into the environment. We need to minimize and release hazardous chemicals and materials that are released into the environment, either from households or from that. And what are the indicators? What is the proportion of wastewater that is safely treated? The truth is, do we have an idea? Do we have data? Do we have statistics on, for instance, the number of households that have their wastewaters channeled? Do we even have wastewater treatment or municipal wastewater treatment network? If we have, how many? If you find out in Lagos, most who even have any wastewater treatment systems are people who live in estates, and not even all estates, but people who live in different areas essentially just have their septic tanks and they discharge their waste into it. And most people don't even empty these septic tanks. So these wastewaters get, the pollutants therein gets percolated potentially into the groundwater. It can contaminate drinking water. We actually have a study that we published in 2019 looking at drinking water quality in Lekki and Ibeju-Lekki area of Lagos. And it would amaze you, we actually found heavy metals there that were beyond the WHO guideline. And if you know Ibeju-Lekki area, you know you are really talking about Ibro areas of Lagos. Consider areas such as Ibafo or more interland. So these are issues. We need to know how much of the wastewater is treated. The wastewaters from the industries, how much of it is treated? Is it actually treated completely, or they just do pre-treatment? Those are other issues that we consider. 6.3.2 looks at what's the proportion of bodies of water with good ambient water quality. So when we're talking about good ambient water quality, we're talking about water quality that meets the criteria for that environment. So we're saying water quality that meets the criteria to support aquatic life. If you're talking about surface water, if you're talking about drinking water, water quality that meets drinking water quality guidelines. We need to look at this. We need to have data. We need to have information. What's the proportion? What are the areas that are lacking in this? Still on goal 6, we have 6.6. And it's saying by 2020, in other words, this year, the target this year is to protect and restore water-related ecosystems. And 6.68 says by 2020, we need capacity building support for developing countries on WASH programs. And that's why you see a lot of funding calls that are out there that has to do with WASH. The Bill Gates Foundation is very strong in this area. The USAID is also very strong in this area, because definitely we are actually in that moment when these are supposed to be achieved. Looking at water harvesting, desalination, water efficiency, wastewater treatment, recycling of water. And then 6.6b targets the support and strengthening the participation of local communities. And I mentioned that previously, that it is very important that when we have a population that is nearing 440 million persons by 2015, it then becomes important that the population of the people themselves are, their capacity is built and they're strengthening to be able to understand what to do and simple measures that they can take in order to be able to support the achievement of these objectives. And so the indicators for 6.6.A1 is what is the amount of water and sanitation related official development assistance that we have, that we actually attract and utilize in Nigeria. 6.6.B1 says, what are the policies, the procedures for participation of local communities? Do we have standard procedures? Do we have guidelines on how local communities can actually participate in the development of the policies and procedures that will support the management of water and sanitation in their communities? Very important. We cannot have someone who lives in Abuja trying to solve the problem in Abakaliki and is not involving the people there. It's simply, he or she simply cannot understand the peculiarities of that environment without involving the local communities. So for goal 11, we have target 11.6, which looks at reducing the adverse per capita from the environmental impacts of cities. And we are paying particular attention to air quality, to municipal. You can see that waste management keeps recurring throughout these targets and indicators. And for 11.6.1, the indicator is what's the proportion of urban solid waste that is regularly collected. So if we have a situation where just 20 to 30% is collected, then we need to improve. Perhaps we get to 50, we get to 70. But in order to get to 50 to 70, it's not just a game of numbers. It's a point of actioning. It's a point of what are the decisive steps that we need to take to improve collection of solid waste. But not just that they are collected, but that they are adequately discharged finally. So we're talking about treatment, we're talking about recycling, we're talking about valorization of this solid waste in Nigeria. If you have a Lagos with a population of 24 million people at the moment, you can imagine the quantum of urban solid waste that we generate. It therefore means that solid waste from a population or a state like Lagos needs to be considered through the value chain, not just from collecting it, but looking at how can we improve. And we have, again, I must say Lagos has some companies that are coming up, even NGOs that are actually getting involved in recycling, particularly recycling of plastics and some solid waste. 11.6.2 talks about what are the annual mean levels of fine particulate matter, particularly 2.5 and 10 in cities. So we're talking about in Kano City, in Port Harcourt, those areas that we have. In fact, last year, I don't know what the situation is, we had a serious population of particulate matter pollution in Port Harcourt. People were literally moving out of that state because they could, when they swiped their hands across their cars, across the windows of their houses, they could basically see soot on their house. This is how bad or how serious the case is. So that in 10 years' time, where we're supposed to be having a reduction or checkmating this, we're actually having this kind of event happening in Port Harcourt. For goal 12, the target by this year is that we want to achieve environmentally sound management of chemicals. All wastes throughout their life cycle, significantly reduce their release into air, water, minimize adverse impacts on human health and environment. And what are the indicators that we want? 12.4.2 says adverse waste generated per capita, what's the proportion? Again, it still goes about what's the proportion that is treated, what's the proportion that is collected, but the treatment, what's the proportion that is pre-treated, complete treatment, what are the issues, what are the types of treatments that are being engaged and that actually could maybe be applied to other areas. These are the information that we should have by now, because it says by 2020, we need to have environmentally sound management of all waste and chemicals. For climate action, it says that by 2030, we need to improve education, we need to improve awareness, raising human and institutional capacity on climate change mitigation and adaptation. And one of the key things of the indicators is that we need to have integrated impact reduction and early warning integrated into the curriculum of primary, secondary, and tertiary schools. I'm aware that the Federal Ministry of Environment in Nigeria has a climate change department, and I think they have a climate change club that they run. I don't know how wide across or how they cut across different states in Nigeria in terms of having these clubs in primary and I think secondary school. But as a lecturer in a tertiary institution, I must say that having that climate change education integrated into our curriculum is still not strong. I mean, I teach environmental pollution and management at the University of Lagos, and this is just a topic. It's as part of the courses that we take. But in terms of having enough education and awareness, we cannot just have students taking a degree in environmental toxicology and pollution management, knowing what climate change is about. It has to cut across people from psychology, to people in sociology, to people in medicine. It cuts across because climate change effects and impacts cuts across. So primary, secondary, and tertiary curriculum need to have climate change integrated in their work. For life below water, it says 14.1 says by 2025, we need to prevent and significantly reduce marine pollution, particularly from land-based activities. And who are the people engaging in these land-based activities? It is man. Land-based activities involving industries, involving waste generated from homes which get washed into the environment, either directly or indirectly. These need to be significantly reduced. And the indicator for this is that what's the index of coastal eutrophication and floating plastic debris density in Nigeria in our marine ecosystems. Sometime in 2016, for those of us that have been following the news, you probably would have heard of the sudden overgrowth of water hyacinth at the Karakal area, at the Ojoju Bega. And a lot of researchers actually brought up the hypothesis, including myself, that it was because of the direct discharge of waste from the abattoir into that environment over the years. The Karakal market actually is one of the largest cow market areas in Lagos, particularly in southwestern Nigeria, and it actually, supports population in these states. And we have particularly been studying that issue and be trying to ascertain the actual cause of that sudden overgrowth of water hyacinth. So when we're talking about coastal eutrophication, this needs to be considered very widely across the marine ecosystems. We also have the issue of plastics. Of course, plastics from land-based activities get washed off. Again, one of my master's students last year did a study looking at different areas, about 14 areas on the Lagos Lagoon, and basically checking what's the quantum of macroplastics that we actually have in this environment. Doing risk perception. Are people even aware about the effects of what they're doing? Are they discharging directly? Of course, they're discharging directly because we actually saw coastal dumps. And some colleagues have also done studies that have seen coastal dumps, laden with plastics in these environments. And we also had a PhD student who did the work on plastics. Several other researchers are also doing, but are we considering this information to really talk about or be able to know what's the quantum, what's the density, what are the things that we need to do, having known this? Again, the Lagos State is being proactive. I happen to work with the Lagos Temitope Environment, and I know that in the moment, they're actually trying to come up with a plastics policy or framework for Lagos State. But then Lagos is just one out of 36 states in Nigeria. We moved to the African Union Agenda 2063 goals, and the aspiration really is there, about 7. It's talking about the Africa we want. What are the things that we need to do? What are the things that we aspire for the Africa we want by 2063? And the implementation plan for these have been categorized in quantum of 10 years each. And in terms of environmental health, 7 aspirations are available, but one of them, aspiration 1, relates to environmental health. And so, for aspiration 1, to have a prosperous Africa, goal 1 has to do with a high standard of living and quality of life as well as well-being. Quality of life, I'm sure you agree with me, doesn't just have to do with money, particularly with current issue of COVID all over the world. We would understand that your money will become an entity when it has to do with your quality of health. So when you're talking about quality of life and well-being, it has to do with what are your exposures, what are the things that you're exposed to, what are the things that you do that can actually bring about adverse health outcomes. So we want to achieve quality of life and well-being for all citizens. You can see that that's really aspirational. Goal 3 says healthy, and the priority areas is we want to have modern and livable habitats and basic quality services available in Africa by 2063. So it means that countries in Africa need to begin to consider how do we improve and make habitats or living modern and supply basic quality services for people. I mean, quality services such as even access to health, right? Access to health assessment, access to a checkup, even access to hygiene. These are basic, but these are challenges that we have, even though it looks basic. Goal 3, we want to achieve healthy and well-nourished citizens. And goal 7 has to do with environmentally sustainable and climate resilient communities. And in terms of that, priority areas for goal 7 has to do with water security. You can see that aligns with some of the UN SDGs, and I'll talk about the alignment very soon. And then the other priority area has to do with disaster preparedness and prevention, just like we have COVID. How prepared are we? What are the emergency preparedness we have in place to ensure our population do not fall heal adversely to the effects of these things. So we're now talking about the alignment between the SDGs and the Agenda 2063 goals. And for the Agenda 2063 goals, the environmental health priorities have identified. For instance, Goal 1 aligns with Goal number 1.5 under no poverty of the UN SDGs. It also aligns with Goal 11 on sustainable cities and communities. That's for Goal 1 of the AU Agenda 2063 goals. Goal 3 of the Agenda 2063 goals aligns with UN SDGs Goal 3 as well. And Goal 7 aligns with Goal 6, aligns with Goal 13, and as well as aligns with Goal 14 on sustaining life below water. So you can see that though these goals are developed by, for instance, the SDGs by United Nations, and then the Agenda 2063 by the African Union, composed of heads of countries, of governments in the African continent, you can see that the alignment between all of them actually points towards sustainable development and achieving health, good health, quality health, and for the populace in Africans, and particularly these ones I've identified for Nigeria. So we want to talk about how do we manage these environmental health challenges. I'm sure for some of us, we are actually quite overwhelmed. And it looks like there is no positive end in sight. I mean, when you're talking about, for instance, those ones that we even ought to have achieved by 2020. And it looks like instead of achieving them, it has become worse. What do we do? And then for 10 years down the line, how do we achieve these very laudable and seemingly high goals, targets, and indicators that we have put here as priorities that Nigeria needs to consider or needs to mainstream? So we have regulatory and development frameworks. If we are interested to know, for some of us, that we actually have in Nigeria an Office of the Special Assistant to the President on Sustainable Development Goals. And they have 3 specific mandates. One of them is to actually gather data. Unfortunately, I couldn't see much data, if any, with respect to the current state of Nigeria from that website. I attended a session by the Nigerian Academy of Sciences last year, and somebody from that office actually came to talk to us. And it was just basically talking about what the mandates are and what they will do. But in 2020, when we're supposed to have an indication of what is our current state, even if we don't know where we are going yet, or if we cannot prove what's our current state, we have that issue in Nigeria of data. Because if we don't have data, how do we support evidence? How do we know the next steps to take? We also have the Federal Ministry of Environment, of course. Their main mandate has to do with managing the environment in Nigeria. And they are specific to the environment in terms of different pollutants, chemicals, energy substances that are discharged into the environment, into the air, into the water, and on land that impacts both animals and humans. So they are not specific, but of course the Ministry of Health is basically concerned with human health. And so in their concern with human health, they also need to consider what are the exposures that human beings have to chemicals, to substances, to energy that can bring out adverse health outcomes in Nigerians. But perhaps because of COVID, we now actually have some data, very live data that we are able to see. And we can see that from those data that are brought forth from the COVID response team by the Federal Ministry of Health, people are able to take decisions. People who want to travel, people who want to work, people who want to do something about their business are able to take decisions. That is what data does. It helps you to know what's the next step to take. Those who want to join the challenge, who wants to support, who wants to help, are able to say, okay, what are the interventions that I need to do? Where do I need to come in? Who do I need to talk to? So the other stakeholders in the areas of environment, like State Ministry of Environment, and even the NEMA, National Emergency Management Agency, needs to look at how do they make their work a bit more visible so that everybody knows what their current state are, and we are able to see how do we support. So as I round up, I just want to share some future perspectives and how we can all be involved. From the poll, I see we're a lot of researchers. I'm very excited that we have a lot of researchers in the house because we have key parts in this. Researchers are supposed to use their research and their studies to impact society. And so we cannot leave this to government. So if we're saying that we have issues of having a centralized database for monitoring and data about these targets and about these indicators, we're saying, how can we support to develop this? But not that we develop this, but that we make it openly accessible. Development agencies are able to assess it and see how can they support. Non-governmental organizations are also able to support and look at what are the areas. We need to do some mapping. For instance, what's the mapping on hygiene and sanitation of what services in Nigeria, in the states, not just the popular states like Port Harcourt and Kano, but those other either two unknowns, well, not unknown, but we don't hear much about them, not that they don't have these issues. Then we need strong and productive collaborations. And this is where I want to talk about the current project I'm leading, evidence use in environmental policymaking in Nigeria. In my introduction, I talked about a period of about 6 weeks that I undertook a science advice for policy fellowship at the Federal Ministry of Science and Technology, particularly in the Environmental Sciences and Technology Department. And this was funded by the African Academy of Sciences. And in that, what I was able to realize in that 6 weeks is that there is a very huge lacuna between what ministries, agencies, and departments of government are doing, these policymakers are doing, with what we researchers are doing. We are all sitting in our space and we're not talking to each other. And of course, because we're not talking to each other, we're not able to integrate and be able to make more impactful those things that we need to do to improve our index. We need collaborations across industries, across research institutions, across government agencies. I'm not trying to be biased, but the University of Lagos is doing that in recent years. We've actually been having a lot of talks and active discussions with having researchers, collaborating with industries, collaborating with government agencies, collaborating with research institutions about how to identify and solve specific development issues that we have in Nigeria. This needs to cut across various universities and research institutions. And these collaborations need to be strong and productive. And so what we're doing with the HILPIN is that we are actually partnering with 3 government policy environmental regulatory agencies: the Federal Ministry of Science and Tech, the Lagos State Ministry of Environment, and the Federal Ministry of Environment Lagos Zonal Office, because that project is hosted and domiciled in the University of Lagos. So a lot of our partners are in Lagos and then in Abuja. And what we're doing, we also have researchers cutting across about 5 or 6 universities in Southwestern Nigeria in the first phase, because we started the project this year. And what we're doing is that we are facilitating capacity building and secondments that we are going to fund, so that we have exchange. The policymakers and the regulators come to the university and research institutions, they look at what we're doing, they look at our research, they look at which areas it aligns with their projects and mandates, and we see how we can collaborate. I must tell you that these government agencies have several projects and mandates ongoing. So the issue is, how do they get this across to the researchers? Because they have the projects to do, but they cannot do the research. They don't have the capacity and the resources to do it. That is where we researchers come into play. We need to be able to bring about demand-driven research that will actually go in to solve current problems and issues that are currently in the face of these government agencies in Nigeria. Then we need to talk about citizen science. Citizen science has become a new norm in the research space in recent times. And citizen science has to do with how do we evolve the common citizens in doing basic science like data collection, particularly in the area of biodiversity assessment. We're actually seeing application of citizen science that is, applying for people getting data, looking at either to unknown species or species that are rare, and they are able to collect it and uphold this on some platforms, and we actually have the data gathered. We can actually apply citizen science to water services. We can apply citizen science to solid waste management. We can do a mapping. I remember sometime last year when we were, the United Kingdom Research Organization kind of provided a platform where they brought in researchers from Africa, and they told us to basically brainstorm on what are the digital innovations that we need to apply in order to solve Africa's problems. And one of the three ideas I came up with, can we have a platform where we have like, you have like OLX, where we have people, you have waste that seemingly to you is a waste, but actually can become a source of raw material to others. But I don't know that you have it. Can we have a platform where such information can be shared? And that can actually reduce the environmental impact of our cities. We are also looking at, can we have online platforms where basic water quality or even wastewater can be monitored? And then with that, we are actually able to deploy, strategic management or monitoring services based on that information that we have, and it is live. We need a very strong database. We need to involve more people, and citizen science has to do with, relates with the indicator on involving local communities in achieving these SDGs. Digital-based and or inspired monitoring. Of course, with the advent of COVID, if you were not, for instance, Zoom, I didn't know about Zoom until COVID started. And I've been over Zoomed in the recent weeks and months. And some of us can speak to that. But we can see the quantum of knowledge, the quantum of development that we can actually have achieved or realized within a short period of time just by having these digital interfaces. These can actually support us and help us with the environmental health challenges that we have. That in the next 10 years, we are able to substantially improve our index and rating with respect to this. Finally, I want to talk about environmental risk communication. There is a strong need for sensitization advocacy in Nigeria. That cannot be overemphasized. It would amaze you, because as part of our work in my group, we do what we call environmental risk perception studies together with the environmental toxicology assessment that we do. And for a lot of the stakeholders in these communities, they're even ignorant of the effect of what they're doing. They're literally ignorant. Some of them, for instance, when we have the issues of solid waste around the Makoko area, they're ignorant on any recycling initiatives that we have available in Lagos. Meanwhile, we actually have some of them. So it is not to develop initiatives, it's not to develop programs. We need to know, is information getting to the communities? Is it getting to the people who need to utilize, who need to make use of this information to be able to solve the problems that we have? Because if we have this initiative out there and some person just sitting in the office and all of that, we will just keep going around in circles. So active sensitization is important. Across social media is great now. Everybody's using social media. In fact, even the so-called common man is very, very adverse, is able to use social media to communicate. Can we use social media to communicate? When I was at the Federal Ministry of Science and Tech, one of the things that I challenged, because I had sessions with the scientific officers, is that you guys have a lot of projects and mandates and work that you're doing there, but we don't know. Can you put yourself out there? And I can say, I did that in August. They've been amazing. They use platforms like Facebook and Twitter, and you see them churning out information about what they're doing. And so people are actually able to access information, but also ask questions and see how they can get involved. These are some of the action points that I've considered, and I feel would really, if we're able to apply it, move us substantially towards the achievement of the SDGs and the Africa we want. These are my references. I want to thank you for your attention, and I can take questions and comments, please. Thank you very much. while I prepare for the questions, I just want to acknowledge all my funders. I want to acknowledge the University of Lagos for giving me the platform. I'm able to undertake these internships and these fellowships and this program because I have the backing of my institution, my department, my mentor. I want to thank my international collaborators as well. I want to thank the associations I'm part of. They provide the platform, they provide the capacity building that has helped me to build a very robust and informed career that I've had in the last 10 years, and which I'm hoping I'm able to, in my own way, impact society. And finally, but certainly not the least, my family is very key. I have 3 children, and because they give me the freedom to be able to do this, I'm able to actually support and contribute to the Africa we want and the Nigeria we want, and to sustainable development indeed of the world. I want to thank everyone. Over to you.
Thank you very much, Dr. Samuel. It seems your network.
Thank you very much, ma. We really appreciate your and the robustness situation. It's you all hear me?
It seems your network is really bad.
Hello, can you hear me? Yeah, it's been raining over here, but it's fine.
Okay, so I just want to say thank you very much to Dr. Temitope Sogbanmu. It was a very, very enlightening presentation. I mean, I'm definitely going to be contacting you after this and, you know, rubbing ideas like I always like to do with you. And in fact, it's something that I never really, there are a lot of contexts and issues that I never really even thought of with regards to environmental health, especially for someone that is a One Health enthusiast. And thank you so much for this presentation. I'll just jump into the questions, and I want to take the first question from Friday Ehigwese. So please ask your question. I'm going to unmute you right now. Please ask your question.
All right, thank you very much. Thank you, Dr. Temi. It's been a good job you've done here, and I'm glad to see you again after CETA conference. Well, I'm asking this question because most of the participants here are researchers, and for you being a member of CETAC, you know that for CETAC some years ago, they published a paper on, well, several papers, but a particular one that was that's actually trending when it comes to validity, reliability, accuracy, and relevance of research data. I'm a researcher working in the field of contaminants of emerging concern, and we wanted to do a global review of some contaminants of emerging concern. And when we got to Africa, it became a Herculean task because we couldn't find data of relevance, related to contaminants of emerging concern in Africa, where the few we got, when we read through them, we found out that they did not meet those criteria for relevance, reliability, accuracy, and validity, either because the samples were not collected properly, or the analytical methods had some flaws and things like that. Now, my question is, looking at the challenges we have with research funding in Africa, how do you think researchers can collaborate across board? I'm not talking about researchers in UNILAG now, leaving UNILAG walls, to collaborating with other institutions in Nigeria or even across the whole of the continent of Africa to be able to come up with relevant, reliable, valid, and accurate data that policymaker can really be so proud of to make a decision regarding environmental health in Nigeria or Africa at large.
Yeah, thank you very much for your question, Mr. Friday. First, I want to start off from the point you made about poor funding, or did you say lack of funds in Africa? I always tell people, and I'm not, I'm trying to be as humble as I can. The truth is we have a problem of lack of information. The truth is the funds are there. The funds are, I tell people, so much. The question is, are you able to access it? Do you have the capacity? Do you have what it takes? You are talking about reliable data. Funders will not part away with hard earned money if your proposal is not truly grounded. A funder will not give you $100,000 if they're not sure about the quality of your work and you've not provided evidence of good quality work in time past. So the truth is we actually have a lot of funds, that are in Africa now. Perhaps I also have the opportunity to know because I'm a member of several networks and academies. For instance, the African Academy of Sciences have several funding information that they've been churning out in the last 1 year. In fact, since I joined, I became an affiliate in 2019. And not just the African Academy of Sciences, even development organizations that like the USAID. We have the Partnership for Enhancement and Engagement in Research, peer grants. These grants information is churned out every year and it is targeted at developing countries. Sometimes it is targeted at specific countries. So please, the truth is we have funds. Whether the funds are coming from our own government or more from development partners is a different issue. Yes, we need to support our government to put in more funds into research, but the ones we even have, the question is, how do we take care of the issue of the capacity of we researchers? And of course, most of the funding information out there now supports multidisciplinary and collaborative research. No longer are the days where you have single researcher just doing, it's not happening again. Do you have the capacity to collaborate across different disciplines? These are some of the capacities that we as researchers need to build. And that is the truth. I must be very sincere. And in order to build it, we must take advantage of the free resources that we have. Like I said, we're in an age of information explosion. If you don't have enough capacity, so many trainings are out there that can help you build. In terms of network, we have a database. I can just mention it here. It's called the African Scientists Database. And there, what they intend to achieve with that database is that they are collating information about research areas, short bios, names and affiliations of researchers and scientists across Africa. And the essence of that is to make possible collaborations across researchers. So if I want to do a research on wastewater treatment or method, and I need a researcher in Ghana, or I need a researcher in Kenya, I might not know someone at the moment, but if I'm able to go to that database, I'm able to streamline according to discipline. I also encourage researchers to join and be active members of professional organizations. Those are platforms and networks that we can actually get the collaborations that we need. So in terms of the issue of data with respect to contaminants of emerging concern, unfortunately, the issue of having reliable data and validity of the data that we have, particularly coming from Africa, is a serious issue. I must agree with you on that. And you would agree with me again that it also comes down to capacity building and infrastructure in this wise. Because when you have institutions, research institutions in Nigeria, because I'm talking about Nigeria, that do not have up-to-date infrastructure, then you have a problem with the kind of data that is churned out, which you would deem reliable, which you would deem valid. A lot of we researchers have to go abroad to be able to access these infrastructures and facilities to churn out good quality papers. Most of my good quality papers have come through my collaborations abroad. We cannot continue to do that. So we must encourage our government, we must encourage industries to support. In the developed countries, it's not just government. A lot of the research support and infrastructure that they have are actually supported and provided by industry. And that's why I emphasize the issue of collaboration. If you come to me as an industry and say you have capacity, you have knowledge to be able to solve a particular issue I'm having, and then the industry churns out some money for you to get some up-to-date facilities, as long as you have the capability to be able to churn out the research, the industry is able to do this. We have to make a case. We have to be like business people sometimes as well. In fact, most times, as researchers as well, we cannot always depend on the government. We can see the government in Nigeria is even running on debt at the moment. So if we continue to wait and depend on them to come and provide the infrastructure that we need, then we will continue to wait forever. So we need to think inward, we need to look outwards and see how can we achieve what we need to get to the next level? How can we make our research accessible? How can we make our research visible and utilizable by the decision makers? I hope I was able to answer some of your questions.
Yeah, that was really informative, and I think you have actually made hit the nail on the head.
Okay, so there's another question here. Thank you very much, Dr. Temitope. There's a question here in the chat box that is asking, have you in your research observed any limitation or hindrances that prevent the public from fully understanding and participating in waste management? Nigerians have a big issue with littering even when waste bins are available, for example. I also want to add to that question by asking, what exactly, I know that there are some upcoming waste management companies that are currently operating, but what exactly are the limitations that are preventing them from expanding and, just basically proliferating from across Nigeria? Because I know that waste management is actually like a big business in developed countries and even maybe not the developing countries like in Kenya and other countries in East Africa. So what exactly are the limitations that is making such companies in Nigeria to still be very confined and constricted in their activities?
Okay, thank you, Kiki. Let me start from the first question about what has been my experience in my own research about the knowledge of stakeholders. Like I said before my background, and I'm very happy that I have some of my past postgraduate students who are online. I just realized in the past 3-4 years now, like I said, we began to consider evaluating the environmental risk perceptions of stakeholder communities where we do studies to find out what is their perception, what's their knowledge about the impact of their activity on the environment and even their own health and what they experience. And like I mentioned, it would amaze you, and we actually have the data, some of these are published in some of our papers, that a lot of these stakeholders, and unfortunately, but not surprisingly, most of these stakeholder communities, when you look at the social demographics data, a lot of them don't have tertiary education. So we're dealing with a semi-literate populace, or sometimes absolutely illiterate populace who don't have an idea of any risk. Tell me why I should not discharge a cellophane bag into the water. There's no waste bin here, and besides, it's going to move to some other location. How is it going to affect me? These are the challenges that we have. And, in terms of why are the waste management companies not booming in Nigeria? When the people themselves don't appreciate or understand in the long term or medium term, the impact of a lot of times we human beings are, if something is not affecting, you can say that when we see that COVID is causing people to die, whether we liked it or not, we all stayed indoors. We are all wearing nose masks. We are all doing that. So until people actually appreciate and actually see tangible how these things can affect my health, a lot of the times they don't bother. So, and that's why I mentioned the issue of risk communication. I was invited to speak at the Lagos State waterfront cleanup in last year, I think December, and at, I can't remember the area now. And these are some of the things that we talked about. That when people see from evidence, from research, and that's why I said we researchers, we need to up our game. When you can provide data and actual information and say, madam, this plastic waste that you are dumping, you know what? By the time you dump it into the water, it will be taken up by the fish. The fish will take it up, and then you will buy the fish. And then when you buy the fish, inadvertently, you are going to take off the plastic. But you know, because the plastic will not degrade very well, and it will perhaps not degrade in a long time, decades, if degradable at all, it will accumulate in your body. Before you know it, you think you are having good life, but your stomach is laden with plastics. We have seen it in research. We have opened up fishes, we have seen plastics in them. And these things get into us. A lot of time, of course, we'll be able to remove the microplastic, but the microplastic will get into us. And these are the ones that we can even see. What about the pollutants that are daring? If we're able to communicate the risks from evidence, from research evidence to these stakeholders in local languages, that's another challenge that we have. Of course, we researchers publish our researches in English. And when the fisherman cannot understand the English that we're writing, not like he can even understand the technical jargon, even the decision makers cannot a lot of time make sense. So we need to begin to look at how do we translate our research evidence into ways and forms that people can assess this evidence and use that to make informed decisions. Use that to become aware and then begin to look at how can they change. We need a behavioral change. And this behavioral change will come about through sensitization, will come about through making research available and accessible. In developed countries, yes, we know that in terms of education, they are up there, but you have a lot of sensitization going on from time to time, such that people are always in the know about how the need to manage their environment. And of course, in terms of waste management, a lot of people in Nigeria, particularly again, rural people or people because of our, the index in terms of poverty index, people don't want to part away with much in order to be able to manage their waste. So if you are telling me to pay so much, so that's why we need to look at other ways, like recycling. If you know, I can't remember the recycling companies now, they now monetize their waste collection. So if you bring plastics, if you bring cellophane bags, you collect something. So they incentivize people to actually bring their waste, and in that way, they are reducing the environmental impact of the city. We need to look at this. We need to look at different approaches, not just people paying for their waste to be collected, but how can we incentivize people? And most of the time, those who are illiterate or semi-literate, or who truly cannot afford for their waste to be collected or treated, how can we incentivize them? Because the truth is, even though they're the ones generating the waste, we're all going to be affected in the long run. COVID started in China, but the whole world is bearing the brunt of it. So it's no longer, it's in my backyard, it's going to get to yours very soon. So we all need to join together and put all hands on deck to see how we can support people from different cadre and strata in order to ensure that we all appreciate the need to manage our waste, and then we look for ways to valorize and incentivize the management of this waste.
All right, thank you, Ma. So I'm going to take one last question, and then because our time is fast spent. So this is from Okweyemi Ogunkoya. She's asking, or he or she, because Okweyemi is a unisex name. What do you advise young professionals who are interested in contributing to policy making? Is extensive years of experience a criteria for being elected as a member of technical committees set up by government agencies? I like that question too.
Yeah, thank you very much. Yes, unfortunately, to a large extent, yes. Years of experience is important because you are providing technical expertise. And of course, you need to be able to demonstrate this expertise for you to be on panels. But indeed, there are some avenues where you can contribute even as a student or with somebody with little or growing experience. I want to talk about the issue of environmental impact assessment. Like I said, I've been part of several panels, maybe like 6 or 10 or thereabouts, and also being, a consultant. And a lot of the time, it is statutory for the Federal Ministry of Environment to make publicly available the draft report of EIA documents for the public, particularly the stakeholder communities, and anybody in that state to be able to come read the report and make comments on it. And almost all the time when they come, and these public hearings or public displays are advertised in the newspapers, and they are also out with the ministries. But a lot of the time, they hardly get any response. So that is one place you can start. If you want to begin to make yourself known, if you want to begin to make yourself visible in the policy-making space, you need to start from places like that. That's where I started from. You need to start from places, you need to go to these hearings. They're free. When you get information, you need to provide. For instance, now, you know about Federal Ministry of Environment. You can make inquiries. When do they have their hearings on any reports? Or sometimes they have stakeholder engagement if they're about to review some guidelines. Even Federal Ministry of Science and Tech or other ministries, they're usually public hearings of major documents. It is a requirement. And so you can begin to partake and contribute to the decision of policy-making process from that light, not necessarily from the place of being part of the technical committee, but you can be from being part of the public. And before you know it, you are advocating, you are commenting, you are getting known, you are getting heard. As you get yourself more visible and known and providing insightful comments, when they need certain reports, because there's some reports that cannot fly without having public comments or without having public input, you will get invited because every time you put a comment, your name and your information and your data is written down. There are also non-governmental organizations you can join, and that's why I emphasize that we need to identify professional societies, active one, and become actively involved. That is how to get yourself, visible, because these organizations work usually with these governments, and when they have active members, they are able to reference you or recommend you or involve you. The journey of 1,000 miles starts with a step. You cannot start a 1,000-mile run by starting at 500. If you manage to start, you're going to break down because you'll not be able to handle what comes to you. But when you go through gradually like that, then you are able to make an impact in your own way. So please, I advise non-governmental organizations join, and sometimes all of these are free. You do or you provide the services free, but you are getting yourself known, you are getting capabilities added to yourself, you are getting knowledge added to yourself. When they are talking about discussing in certain space, you know what to say because you've been part of it. And that way, you can find yourself contributor. And please improve yourself in terms of knowledge. If you are invited to come and talk about what has been your experience in this space, let it be clear that you are knowledgeable in this area. And then you are going to get yourself visible and known, and you'll be invited very soon. And again, there's so many opportunities too, scholarship opportunities, fellowship opportunities that you can utilize that provides internship for young people. For instance, I think in recent times, we've had World Bank fellowship for young people, where they give you a platform to come and have a look at what happens within this bank. We also have the same in some NGOs, either African or Nigerians. Take hold of those opportunities, even if they don't pay. I always advise. I cannot talk about the number of activities I've done that have not been paid for, but I can tell you that I mean, the payment that I get now has been a lot more from those activities that have been. Be in steering committees of professional societies, lead an activity, lead a work group, be an active part of a work group. And then slowly but surely, you get there.
I just have to give a round of applause from here to Dr. Temitope Sogbanmu for a wonderful presentation, going even further to charge us, especially since a lot of us here, I suppose, would be youth and students, professionals and researchers, you know, and encouraging us to push and be consistent, to network, and to basically not just sit down on the sidelines, but to be more proactive in making sure that we get our voices heard, and also, of course, to build our career along the same line. So thank you very much, Dr. Temitope Sogbanmu. This has been a very wonderful evening and a productive one too. And I want to also mention that if you are interested in the organization evidence using policy making, you can always, it's online. I would type the website in the chat box. And if you also want to contact her, I'm going to share, is it okay if I share your email, Ma?
Yes, you can. And you can also maybe share the contact details of the project assistant. He's actually in the chat room, Osegale Healing. I want to thank him as well. I acknowledge him. He also helped me with putting together and preparing for this presentation. So he is the project assistant on the project, and yes, we can also contact him. On the website, all the numbers and email addresses to contact are there.
Okay. So there you have it, and I want to wish us all a very good evening. Thank you for joining the webinar. The recording will be on YouTube by Monday, unfailingly. So you can always access them, and we're going to share emails, of course, to at least give you a recap and also to let you know when the recording is up and online. So thank you so much. Thank you, Dr. Temitope Sogbanmu, for gracing, honoring our invitation. Thank you, audience, for listening and also being very, you know, being a very, very good and cooperative audience. And thanks to everyone for joining us. I wish us all a good evening and a wonderful weekend. Stay safe, protect yourself, and reach for the heights that you can ever want to reach for. Thank you.
Thank you very much.
Yes. Bye-bye, everyone.